Narcissistic personality disorder, NPD, is a complex mental condition characterized by an inflated sense of self-importance, a deep need for excessive attention and admiration, troubled relationships, and a lack of empathy for others. Yet, behind this mask of extreme confidence lies a fragile self-esteem that's vulnerable to the slightest criticism. This video summary aims to delve deep into the nuances of NPD, exploring its symptoms, causes, impacts, diagnosis, and treatment, and providing insights into how it affects individuals and those around them. Narcissistic personality disorder is one of the several types of personality disorders, and it typically manifests in early adulthood. According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, NPD is characterized by a pervasive pattern of grandiosity, in fantasy or behavior, a constant need for admiration, and a lack of empathy. This pattern begins in early adulthood and presents in a variety of contexts. The symptoms of NPD can vary in intensity and may include grandiose sense of self-importance, exaggeration of achievements and talents, expecting to be recognized as superior without commensurate achievements. Preoccupation with fantasies of unlimited success, power, brilliance, beauty, or ideal love, persistent thoughts about being powerful, successful, or attractive. Belief of being special and unique, insistence that they can only be understood by, or should associate with, other special or high-status people or institutions. Need for excessive admiration, constant need for admiration and validation from others. Sense of entitlement, unreasonable expectations of favorable treatment or automatic compliance with their expectations. Interpersonally exploitative behavior, taking advantage of others to achieve their own ends. Lack of empathy, unwillingness to recognize or identify with the feelings and needs of others. Envy of others or belief that others are envious of them, often feeling envious of others or believing that others are envious of them. Arrogant, haughty behaviors or attitudes, demonstrating arrogant, superior, and disdainful attitudes or behaviors. Researchers have identified different subtypes of narcissism, which help in understanding the complexity of the disorder. Grandiose narcissism, this type is characterized by arrogance, dominance, and a sense of superiority. Grandiose narcissists are often extroverted and seek attention and admiration. Vulnerable narcissism, these individuals are more introverted and hypersensitive. They may appear shy or reserved but harbor grandiose fantasies. Vulnerable narcissists are prone to anxiety and depression. Malignant narcissism, this severe form combines traits of NPD with antisocial behavior, aggression, and paranoia. Malignant narcissists are highly manipulative and often engage in exploitative and harmful behaviors. The exact cause of NPD is not known, but it is likely a combination of genetic, environmental, and psychological factors. Genetic factors, some traits of narcissism may be inherited. Studies suggest that there may be a genetic predisposition to personality disorders, including NPD. Environmental factors, excessive adoration or excessive criticism from parents or caregivers can contribute to the development of narcissistic traits. Childhood abuse or neglect can also play a significant role. Psychological factors, early experiences of trauma or disruption in attachment during childhood can impact the development of self-esteem and coping mechanisms, contributing to narcissistic behavior. Impact on relationships and daily life. NPD can significantly impact various aspects of an individual's life, including personal relationships, work, and mental health. Personal relationships, individuals with NPD often have troubled relationships due to their lack of empathy, need for admiration, and exploitative behaviors. Their relationships can be marked by conflict, dissatisfaction, and volatility. Work environment, while their confidence and ambition can initially lead to success, their inability to accept criticism, collaborate with others, or take responsibility for their actions can create a toxic work environment and hinder long-term career success. Mental health, Those with NPD are prone to experiencing depression, anxiety, and other mental health issues, particularly when their self-image is threatened or they face failure and criticism. Diagnosing NPD can be challenging as individuals often do not recognize or admit that they have a problem. A comprehensive assessment typically involves clinical interviews, structured or semi-structured interviews to gather information about symptoms and behaviors, psychological testing, standardized assessments and questionnaires to identify narcissistic traits and rule out other personality disorders, observation and history, detailed personal and medical history to understand the development and pattern of behaviors. Treating NPD is challenging, primarily because individuals often resist therapy and do not believe they need help. However, several therapeutic approaches can be effective. Psychotherapy. The primary treatment for NPD is psychotherapy. Cognitive behavioral therapy, CBT, and psychodynamic therapy can help individuals understand their behaviors and develop healthier coping mechanisms. Medication. There are no specific medications for NPD, but associated symptoms like depression or anxiety can be managed with appropriate medications. Group therapy. Participating in group therapy can provide individuals with NPD opportunities to receive feedback and develop empathy and social skills. Family therapy. Involving family members in therapy can help improve communication and relationships within the family unit. If you are in a relationship with someone with NPD, it is crucial to develop strategies to protect your well-being. Set boundaries. Establish clear boundaries to prevent manipulative or exploitative behaviors. Practice self-care. Prioritize your mental and emotional health by engaging in activities that bring joy and relaxation. Seek support. Reach out to friends, family, or a therapist for support and guidance. Manage expectations. Understand that you cannot change the person's behavior. Focus on managing your reactions and maintaining your well-being. Avoid engaging in power struggles. Narcissists thrive on control and dominance. Avoid getting drawn into power struggles or arguments. The rise of social media and digital technology has added new dimensions to narcissistic behaviors. Platforms like Facebook, Instagram, and Twitter provide narcissists with opportunities to seek validation and admiration from a wider audience. The constant need for likes, comments, and followers can exacerbate narcissistic tendencies and contribute to the development of narcissistic traits in individuals who might not have otherwise exhibited them. Social media can also amplify the negative impacts of narcissism, including cyberbullying, online harassment, and the spread of misinformation. Understanding the relationship between narcissism and digital technology is crucial in addressing these challenges and promoting healthier online behaviors. To better understand NPD, consider the following hypothetical case studies. Case Study 1, John, the grandiose narcissist. John is a successful businessman who prides himself on his achievements. He often exaggerates his accomplishments and expects constant admiration from his colleagues and subordinates. John's relationships are superficial, as he finds it difficult to empathize with others and often exploits his friends and family for personal gain. His inability to accept criticism leads to frequent conflicts at work, where he is viewed as arrogant and difficult to work with. Case Study 2, Lisa, the vulnerable narcissist. Lisa is an artist who struggles with feelings of insecurity and inadequacy. She craves admiration and validation, often fantasizing about being recognized as a great talent. Lisa's relationships are marked by a fear of rejection and intense sensitivity to criticism. Despite her outward shyness, she harbors a sense of entitlement and believes that others do not appreciate her unique qualities. Preventing NPD involves addressing the factors that contribute to its development. Healthy parenting, encouraging balanced praise and constructive criticism, setting appropriate boundaries, and fostering empathy in children can help prevent the development of narcissistic traits. Early intervention, Identifying and addressing early signs of narcissistic behavior in children and adolescents can prevent these traits from developing into a full-blown personality disorder. Education and awareness. Raising awareness about the characteristics and impacts of NPD can help individuals recognize the signs and seek help early. One of the core deficits in NPD is a lack of empathy. Enhancing empathy is a crucial component of treatment. Therapists often focus on helping individuals with NPD develop a better understanding of others' feelings and perspectives. Techniques such as role-playing, perspective-taking exercises, and mindfulness practices can be effective in increasing empathy and improving interpersonal relationships. Treating NPD presents several challenges. Resistance to therapy. Individuals with NPD often do not see a problem with their behavior and may resist therapy. Therapeutic alliance. Building a therapeutic alliance can be difficult, as individuals with NPD may view the therapist as inferior or become defensive. Long-term commitment. Effective treatment requires a long-term commitment, which can be challenging for individuals who seek quick fixes. Despite the challenges, many individuals with NPD can benefit from treatment and achieve positive outcomes. Improved relationships. With therapy, individuals can learn to build healthier, more fulfilling relationships based on mutual respect and empathy. Enhanced self-awareness. Increased self-awareness can help individuals recognize and modify their narcissistic behaviors. Greater emotional stability. Developing healthier coping mechanisms can lead to greater emotional stability and reduced symptoms of depression and anxiety. In conclusion, narcissistic personality disorder is a complex and multifaceted condition that impacts individuals and those around them. Understanding the symptoms, causes, and treatment options is crucial in addressing the challenges associated with NPD. Through comprehensive therapy, individuals with NPD can develop healthier behaviors, improve their relationships, and achieve greater emotional well-being. Raising awareness and promoting early intervention can help prevent the development of narcissistic traits and support those affected by this disorder. Thank you for watching. Please subscribe, like, and share.